As a hospital representative responsible for assisting patients, you are often required to refer patients for Medi-Cal and County Indigent Health Services eligibility determination. When making such referrals, you may work with county staff from the Hospital Outstationed Services Program. Being able to perform eligibility determination functions in the hospital improves access to care for eligible applicants.
To help you understand the roles of everyone involved in the referral process, and to give you the information you need to deal with the sensitive issues surrounding potential fraud in these public programs, the Hospital Council has partnered with the County of San Diego and the California Department of Health Services Investigations Unit to provide you with public program referral and fraud prevention training.
The Hospital Council of San Diego and Imperial counties is an association of local hospitals which co-facilitates the HOS program and serves as the communication link between the individual hospitals participating in the HOS program and the County Department of Social Services. This training is part of our effort to eliminate fraud within the Medi-Cal and CIHS programs within participating hospitals. Fraud prevention must be conducted in a manner and in an environment which is consistent with the county's duty to assist applicants in obtaining benefits to which they are entitled.
This video is only a summary of the mandatory training. Training sessions are offered on a quarterly basis, and staff who routinely work with the HOS program are required to attend a full training session. The full training sessions cover in detail the key components to avoiding potentially fraudulent situations in the HOS program and is provided by the hospitals, County Department of Social Services, and the California Department of Health Services Investigators Unit. Your HOS liaison will schedule this training session. In this video, you'll be provided with an overview of the Hospital Outstationed Services Program, the Hospital Council policy prohibiting Medi-Cal and CIHS fraud, and situations of potential fraud.
An HOS eligibility technician is an employee of the county and works in a hospital which participates in the HOS program. The HOS ET is responsible for interviewing patients, collecting applications and supporting documentation, answering eligibility-related questions, reviewing applications, and assisting to determine a patient's eligibility for benefits. Questions patients may have concerning the eligibility process should be directed to the HOS ET.
Your hospital has assigned one or more persons to represent your facility with issues surrounding the HOS program. This role is referred to as a hospital liaison. These liaisons work with the HOS ET, the HOS ET supervisor, and with the hospital council to address any concerns or questions you have regarding the program. They also have the responsibility of ensuring that hospitals adhere to the laws and regulations regarding the Medi-Cal and CIHS eligibility process to help ensure fraud prevention.
Hospital staff assisting patients with the Medi-Cal and CIHS eligibility process are able to help patients obtain, submit, or provide the requested verifications, provide aid with the completion of the MC-210 Statement of Facts, accompany and assist during a face-to-face interview, provide interpretation services, provide transportation services, and assist in the appeal process. Hospitals may choose to assign hospital employees or agents with the responsibility of helping patients by gathering verifications, providing transportation, or assisting in other aspects of the application process. It is imperative that hospital staff who assist patients in completing the MC-210 Medi-Cal Statement of Facts form sign the box marked "Person helping applicant fill out the form." In addition, hospital staff need to be aware of the restrictions and guidelines surrounding completion of other eligibility-related forms. Refer to your HOS policy and procedure manual and/or hospital guidelines for details on filling out eligibility forms. These restrictions will also be reviewed in your full training session. The Hospital Council and the county share the mission and philosophy that patients who are eligible for Medi-Cal and CIHS benefits should receive them.
Hospital staff assisting patients must adhere to the Hospital Council policy prohibiting Medi-Cal and CIHS fraud. The policy states that no hospital staff can intentionally act to solicit fraud by coaching, instructing, advising, or guiding any hospital patient to obtain benefits that they are not entitled, receive a greater benefit than would otherwise be available, or prepare for a fraud investigation. Fraud is a willful, knowing, and intentional perversion of the truth for the purpose of persuading another person to part with something valuable or to surrender a legal right. The false representation of fact through words, conduct, false or misleading allegations, or concealment of information which intentionally deceives another person so that the person might act upon it to his or her own detriment. Fraud jeopardizes a patient's eligibility for benefits and can also result in legal action against the patient, you, and your hospital.
Soliciting is the legal term for coaching. It is defined as the intentional act of tempting or coercing someone to do wrong, such as advising Medi-Cal and CIHS applicants to conceal relevant information or provide false information to establish eligibility for welfare benefits. In order to prevent fraud and the appearance of fraud, hospital staff need to adhere to the Hospital Council policy prohibiting Medi-Cal and CIHS fraud, as well as any guidelines your hospital has adopted regarding confidentiality, the referral process, and communication with the HOS/ET. Remember, the role and functions of hospital staff is to assist patients with the eligibility process, not to act as a qualifying agent.
The following examples will help you to see how the fraud prevention policy applies to daily interactions between patients and hospital staff. The examples will also distinguish the differences between assisting and soliciting behaviors.
This first example addresses the issue of a patient's residence. The patient tells you that she has been living in town, but will be moving to another state or country soon. Since she is seeking coverage for services provided while she was a resident, you tell her not to risk ineligibility by informing the HOS/ET of her plans.
This is an example of soliciting. By advising the patient not to inform the HOS/ET of her plans, you are soliciting the patient to conceal information that could affect eligibility. Instead, as hospital staff, you should inform the patient to tell her plans to the HOS/ET, as well as inform the HOS/ET of the patient's spoken intention.
This second scenario concerns a patient's property holdings. The patient has complex ownership circumstances and is unsure what documents or property holdings are relevant. You agree to review his records and advise him not to report his property.
This is an example of soliciting. By advising the patient to conceal relevant information, you are coaching them on what to do. Hospital staff should not agree to advise a patient on how the patient should act with regard to eligibility information. Though it is not illegal to give advice, hospital staff run the risk of being wrong and jeopardizing a patient's eligibility. Hospital staff or an agent may assist the patient in gathering information about the patient's extenuating ownership and property, as well as inform them of consequences about misrepresentation. You should also encourage them to speak to the HOS/ET.
A patient comes to you and informs you that his Medi-Cal application was denied. The patient goes on to explain that he cannot afford the medical care needed. You suggest that he reapply to another ET, since a different ET could possibly grant his case.
This is an example of soliciting. By suggesting to a patient that they reapply, you have stepped out of your role as hospital staff and are now instructing them on what to do. If the patient really is not eligible, then you'd be trying to qualify an individual for something that they are not entitled to. Hospital staff may assist patients by informing them that they have the right to appeal. As hospital staff, you may help them with the appeal process by identifying the phone number to call, which is found on the back of the Notice to Action form, and paperwork needed to begin the process.
This next scenario is regarding a patient's employment and income history. The patient discloses that he has not paid income tax while getting paid under the table by his employer. You tell him that he does not need to disclose all of his income on the Medi-Cal application.
This is an example of soliciting. A patient instructed not to disclose all of his income, regardless of being paid under the table, is concealment of information. Hospital staff should not be providing such instructions. Instead, hospital staff should inform the patient to tell the HOS worker about his source of income and earnings made, as well as relate the information to the ET.
We would like to emphasize that your role as hospital staff is to support and assist patients with the eligibility process, as well as refer questions to the HOS-ET. As hospital staff assisting patients through the eligibility process, you are able to obtain and submit or provide the requested verifications, provide aid with the completion of the MC 210 Statement of Facts, accompany and help the patient during a face-to-face interview, provide interpretation services, provide transportation services, and assist with the appeal process. When assisting patients, hospital staff need to be aware of what their hospital's policy is on assisting patients with forms or transportation. Refer back to your HOS liaison if you have any questions.
The California Department of Health Services Investigations Unit is responsible for investigating cases of possible fraud within the Medi-Cal program. Investigators receive referrals of potentially fraudulent situations. They work closely with the County Department of Social Services to ensure that potential fraud cases are investigated. Referrals may be received from the Department of Social Services, California Children's Services, hospital staff, other providers, and the community. Investigators conduct investigations and acquire information that ensure that eligible applicants receive entitled benefits and prohibit ineligible individuals from receiving benefits under false circumstances.
Some examples of potential fraud cases that are investigated include residency, false applications, perjury, solicitation, misuse of Medi-Cal card, failure to report other health insurance, or an activity known as doctor shopping, which occurs when persons use their Medi-Cal card to obtain controlled substances by fraud, deceit, or misrepresentation. Some of the more common referrals made to fraud investigators that fall under false applications and perjury include property. The applicant's failure to report any item of property could result in total ineligibility. Income. The applicant's sources and/or amount of income are not reported, which could result in a share of cost. False identity. The applicant is an imposter who provides false or altered identity documents, or may claim to have no documentation at all. Absent parent. The applicant fails to report the presence, income, or property of the other parent in the home. Child out of the home. The applicant fails to report that one or more of the children do not live in the home.
The HOS-ET makes referrals if he or she suspects a patient might be attempting to become eligible for Medi-Cal or CIHS by intentionally providing false information. Anyone may call the public 24-hour toll-free number for Medi-Cal fraud. That number is 1-800-822-6222. The public number for CIHS is 565-3140. Intentionally providing false information jeopardizes a patient's eligibility for benefits. It can also result in legal action against the patient, you, and your hospital.
You have now seen an overview of the HOS program as well as the Hospital Council policy prohibiting Medi-Cal and CIHS fraud adopted by your hospital. You will receive more information when you attend the full training session. If you have any questions regarding the HOS program, you can always refer to the HOS Policy and Procedure Manual or obtain information by contacting the hospital HOS liaison at your site. The Public Program Referral and Fraud Prevention Training Program has been created to assist you in understanding the various roles in the referral process. By working together and adhering to the Hospital Council's policy on fraud prevention, we can help eliminate fraud within the Medi-Cal and CIHS programs.